An Environics poll finds almost 40% of Canadians went to work sick at least once during the pandemic. 19% of the more than 5,900 respondents say they went in several times while ill. 20% rarely went into work sick, while 59% never did in the past year. Now, the poll didn't include people working from home due to COVID-19 precautions, but people say they go to work sick before the pandemic because they had too much work to do, no sick days or pressure from the boss and colleagues. For more, let's bring in Andrew Parkin, Executive Director at the Environics Institute for Survey Research. Good to see you, and this is such a fascinating look at people's, work habits before and after COVID. Were you surprised by the results?
I don't think I was surprised to find that some people go to work sick. I think we've all experienced that either ourselves or are looking around our place of work. And I don't think I was surprised to find out that those who don't have access to paid sick days are the most vulnerable workers. So people who are working part-time, people who are earning lower incomes, people who are working in the sales and service sector, they may be going to work sick because otherwise they wouldn't get paid. I think the part that jumped out to me is that there are a number of people who are going to work sick and they do have access to paid sick days. So there's other reasons, the ones that you mentioned, the sense of obligation to your employer, to your coworkers. And I think that's a really important finding because it tells us that paid sick days are a big part of the solution, but they can't be the only part of the solution.
Right. What's the message to employers, though? Let's start there.
Well, again, I think that, the first message is you have to provide paid sick days because otherwise those who are, in an economic situation where they can't afford to stop working are in a difficult situation. But the second message, I think, is we need to create a culture where it's no longer seen as heroic or dutiful to show up to work sick, to make that meeting even though you've got a headache or a cold or a sore throat. So we need to change that from being seen as dedicated to, essentially being seen as irresponsible. So employers, I think, have to set the tone and tell their employees that it's all right to stay home, that it's expected to stay home, that they're not going to be left out and they won't be penalized.
But what if you're given the impression, or you just feel it yourself, that because of COVID, and especially with the Omicron variant, there's a manpower shortage? We see it in our healthcare workers. We're going to see it in our teachers. Some workplaces are decimated.
That's right. I mean, we're in a crisis situation right now, so I think we have to, accept that there's going to be, I guess we need, emergency measures to get through the next little while. But we have to look beyond that because Omicron, I think we can all be certain at some point will pass. But then the question is, what comes next? And are we going to learn any lessons from this? And that is when I think we have to think, what have we learned about how we can work remotely, how we can have different ways of staying connected to the office, and how can we now use those to our advantage? Again, we have to make it so that people don't feel they're missing out, that they're going to, not get a promotion, not be seen as, a responsible employee if they put their hand up and say, you know what, I think I better spend the next couple days at home until I see where this is going.
Yeah.
And that's something we can all work on together. Again, it's up to the bosses, but it's also up to coworkers to kind of create that social expectation that's really different from what we had before the pandemic.
For sure. I've got about a minute left, Andrew. What about a racial and gender divide that appeared in response to the question, do you go to work when you're sick?
Again, I think it comes back to those who are at a disadvantage in the workplace. If they're racialized, women compared to men, low income compared to higher income, they are all less likely to have access to paid sick days. So they're put in a vulnerable situation where they have to make that choice between going to work when sick or not getting paid, which is, almost an impossible choice. So we do have to look at that inequity and address it through paid sick leave, but then again, push beyond that too and create this workplace where we're all supporting each other. And part of that means supporting each other, encouraging people to stay away from the workplace if they're not feeling well.
It might be one of the good things to come out of this virus.
There's still time to learn lessons.
There you go. Andrew Parkin, Executive Director, Environics Institute for Survey Research. Really appreciate your time. Thank you.